Chapter 7, Lesson 7.1. So we're going to talk about nitrogenous wastes, urea, creatinine, and uric acid, and the functions of the kidney. So it filters nitrogenous wastes to form urine. About 200 quarts of blood are filtered every day to form 2 quarts of urine. And this helps to maintain proper balance of water, electrolytes such as sodium and potassium, and acids. Releases hormones such as renin, which is an enzyme important in adjusting blood pressure, erythropoietin, which is often abbreviated as EPO. It's a hormone that stimulates red blood cell production in the bone marrow, and calciferol, which is the active form of vitamin D necessary for the absorption of calcium from the intestine, and then also to degrade and eliminate hormones from the bloodstream. So the anatomy of the major organs of the urinary system of a male is the kidney, ureter, urinary bladder, and urethra. So here's an anatomical illustration with the pertinent organs. So you have the kidneys, 2 ureters, 1 out of each kidney, which go to the bladder, and then the urethra, and at the bottom, the urinary meatus, or opening. The organs of the female urinary system are the kidney, ureter, urinary bladder, and urethra. So pretty similar up here, 2 kidneys, 2 ureters coming out into the urinary bladder, with the urethra descending, and then the urinary meatus, the opening. So what is voiding? Does everybody remember what it means to void? Is it the nitrogenous waste, the active urination, the outer section of the kidney, or the triangular area in the bladder? And hopefully everybody said B, urination. So how do kidneys produce urine? Blood enters the kidneys through the right and left renal arteries, and then the arterioles carry blood to the capillaries, and the glomeruli filter the blood. As the blood enters the kidneys through the right and left renal arteries, here's a renal artery, and then a renal vein. The arterioles carry blood to the capillaries, and on the end of there is the glomeruli, which filters the blood. The glomerulus and glomerular Bowman capsule. So this is where the blood passes through the glomeruli, and the Bowman capsule, glomerular, surrounds each glomerulus. The renal tubule is attached to each Bowman capsule. So here's an illustration of the Bowman capsule, the glomerulus, or the capillaries there. Afferent, meaning the blood coming into the glomerulus, and then efferent, meaning that it's flowing away from it, and then the filtering out of the sugar, water, urea, and other wastes and salts into the renal tubule. So the 3 steps in the formation of urine, which is glomerular filtration, which we just looked at, pulling out the water, sugar, wastes, and salts. Then the tubular reabsorption, reabsorbing the water, sugar, and sodium. And the tubular secretion, getting rid of the acids, potassium, and any drugs or other substances. So here's that same illustration we looked at, expanded upon. The Bowman capsule, the arteriole, and the steps of the glomerular filtration up here, then the tubular reabsorption here in the renal tubule, and then the tubular secretion down at the bottom, right before the collecting tubule, which goes to the pelvis. So then you have your final product of urine, which is 95% water and 5% waste, such as urea and creatinine and salts, acids, and drugs. So combined, the glomerulus and the renal tubule form a unit called a nephron. So here's the glomerulus inside the Bowman capsule, the renal tubules all around here, and so that is one nephron. Oops. Okay, sorry, we're going to go back to our quick quiz here. Approximately how many nephrons are in a kidney? 100,000, 10,000, no, that's 10 million, sorry. 1 million, there's 100,000. What do you think? How many nephrons? So the correct answer is C. There are about 1 million nephrons in one kidney. So that's a fair amount. So all the collecting tubules lead to the renal pelvis. Calyces are small, cup-like regions of the renal pelvis, and the term comes from the Greek calyx, which means a cup or a case surrounding a flower bud. So here you have the little calyces that look like cups, the renal pelvis leading out of the ureter. So again, the functions of the kidneys are to remove nitrogenous wastes, balance our water and electrolytes, release hormones, and then degrade and eliminate hormones. So this is kind of a never-ending feedback loop here, where you have the bloodstream through the renal arteriole to the glomerulus, filtration process into the glomerular capsule, and then the renal tubule. And from here, there's reabsorption of necessary water, sugar, and salts back into the bloodstream, and then as well as secretion of acids, potassiums, and drugs and other substances into the renal tubule. And then to the renal pelvis, into the ureters, down to the bladder, down into the urethra, and then urine leaves the body through the urinary meatus, which means opening. So our vocabulary terms are arterial, calyx, catheter, cortex, creatinine, electrolyte, and here's our definitions. So make sure you review these, download the slides. Erythropoietin, or EPO, filtration, glomerular capsule, glomerulus. I know those are tough to say. Glomerulus. The hilum, kidney, meatus, medulla, nephron, nitrogenous waste, potassium, reabsorption, renal artery, renal pelvis, renal tubules, renal vein, renin, sodium, trigone, urea, ureter, urethra, uric acid, urinary bladder, urination or avoiding, okay, so we'll go through some of the prefixes, terminology structures now. So kilo or kilosio, which is calyx, cup-shaped. Cysto, urinary bladder. Glomerulio, which is the glomerulus. Meato, for meatus. Nephro, kidney. Paielo, which is pertaining to the renal pelvis. Reno, or kidney. Trigono, trigon. Ureter, or uretero, meaning ureter. Urethro, meaning the urethra. And vesico, or vesic, pertaining to the urinary bladder. Here's our substances and symptoms. Albumin, azot or azoto, pertaining to nitrogen. Bacteria or bacterio, bacteria. Dips or dipso, meaning thirst. Cal or calo is potassium. Ket or keto or ketone or ketono are the ketone bodies. Lith is stone. Natri or natro is sodium. Nocto is night. Olig or oligo is scanty, so not very much. Poietin means a substance that is formed. Pi or pio is pus. Tripsy means to crush. Ur or uro is urea. And then urea pertains to urination or a urine condition. And urine or urino is urine. So urinalysis, we'll look a lot more at this in Ma125, where we actually will run a urinalysis here in probably a month or two. So the tests that are included in a urinalysis is the color of the urine, the appearance, so that has more to do with the clarity level, and then the pH level, the number of protein molecules in the urine, and then the number of glucose molecules. Also, the specific gravity is checked, so that has to do with the concentration level of solids versus liquid. Ketone bodies, we measure the number of ketones in the urine. Sediment, which is more to do with the solids. And then phenylketonuria. And then bilirubin. Those are all things that we look for in the urinalysis. So in the urinalysis, what does the test of specific gravity reflect? The chemical nature of urine, the presence of albumin, if there's blood in the urine, or the amount of waste, minerals, and solids in the urine. So what would you guess? Chemical, albumin, blood. So these are all things that we measure separately in the urinalysis. We also measure for the presence of blood, albumin. So it's the amount of waste, minerals, and solids in the urine. So actual solids as opposed to liquids. Okay, so that's the end of lesson 7.1. All right, welcome to lesson 7.2. Talk more about the kidneys. So, pathological conditions of the kidney can be glomerulonephritis. You got to say that slow, right? Interstitial nephritis, nephrolithiasis, and nephrotic syndrome. Also, polycystic kidney disease, or PKD. That is when the kidney contains masses of cysts. And normally, so polycystic kidneys will weigh 20 times more than their usual normal weight. So here's a kidney covered in cysts. Pyelonephritis, renal cell carcinoma, renal failure, renal hypertension, and Wilms tumor. Here is a renal cell carcinoma tumor right here on the kidney. And then as far as the urinary bladder goes, pathological condition would be bladder cancer. And then associated conditions with kidneys are diabetes insipidus and diabetes mellitus, DI and DM. Okay, so what do we think a term that means frequent voluntary urination at night is? So that means that we have control over it. So it's not uncontrolled or involuntary. Would it be anuria, nocturia, diuresis, or hematuria? So I bet you guys can figure that out, right? Anuria would mean, A means without, so that would be no urination. Diuresis is, it is frequent urination and elimination of excess water. And then hematuria would be blood in the urine. So noct, meaning nighttime, would be nocturia. Hopefully you guys got that right. Okay, so common laboratory tests run to check the function of kidneys would be blood urea nitrogen, or BUN, and then a creatinine clearance test. Clinical procedures that could be done would be x-rays, so a CT urography. You can also take a look at the kidneys, ureters, and bladder, KUB. You can do a renal angiography, a retrograde pyelogram, and then a voiding cystourethrogram. So that would be while urinating, while voiding. So here's a CT scan. CT stands for computed tomography, and this scan is using contrast to show a benign cyst on the kidney. So here's the kidney. This is looking down. A slice, it's pretty much like if you cut somebody, sliced them in half, and this is looking down on top of the kidney, and here's the cyst right on top. It's pretty big. The voiding cystourethrogram, VCUG. So this is showing a normal female urethra, and the bladder is filled with contrast material, and then we follow it all the way through with x-ray imaging, so we can see it empty from the bladder through the urethra and then the urinary meatus to look for any abnormalities there. Clinical procedures, could do an ultrasound exam, an ultrasonography, imaging the urinary tract structures using high-frequency sound waves, radioactive studies such as a radioisotope scan. This is an image of the kidney after injecting a radioisotope into the bloodstream, so we can follow that radioisotope all the way through the bloodstream and then filtering through the kidney to see if there's any issues with how things are flowing through there. Magnetic imaging, so MRI, magnetic resonance imaging, can do a urography. This is changing magnetic field produces images of the organ and the surrounding structures in 3 different planes of the body. Other clinical procedures would be a cystoscopy, dialysis, lithotripsy, renal angioplasty, renal biopsy, renal transplantation, and urinary catheterization. So the cystoscopy is a direct visual exam of the urinary bladder with an endoscope. So a little wire is threaded up through the urethra, and it's got a camera on the end, and so they can get a direct visual exam of every structure through there. Hemodialysis, or HD, that is when somebody's kidney is not able to do the filtering on its own, and so people get hooked up to HD hemodialysis machines, and that does the work of the kidneys for them to filter out all the waste products. continuous ambulatory peritoneal dialysis. So this is CAPD. This is another way of performing dialysis. So the dialysis solution is, it goes in through a catheter and then comes back out through a draining catheter. So our abbreviations that we talked about are ADH, AKI, ARF, BILI, BUN, CAPD, CATH, CCPD, and CKD. So we need to make sure we know what all of these stand for. Okay, so I realize I should probably define all of those for you. So ADH stands for antidiuretic hormone. AKA is acute kidney injury. ARF is acute renal failure. BILI or Billy, it can be either bilirubin or also often the Billy Light is used on newborns who are experiencing jaundice. BUN, remember that's the blood, urea, and nitrogen. CAPD, so we just looked at that. That was the continuous ambulatory peritoneal dialysis. So ambulatory means that the person can walk around. And then CATH, cath, that's short for catheterization. CCPD is similar, right? So it's continuous cycling peritoneal dialysis. So that's when the person's actually hooked up to a machine and is unable to ambulate. So that's the difference between those two. And then CKD is chronic kidney disease. Oh yeah, there you go. There's all your definitions right there for you. So we'll skip this one and go to the next one that has the definitions. Cl stands for chloride, which is a kidney excretion. CrCl stands for creatinine clearance. CRF is chronic renal failure. Remember on the previous slide we had acute renal failure. So remember the difference between chronic and acute would be if something has been present there for 3 months or more, then it goes from being acute to chronic. A CNS, that's a culture and sensitivity testing. Cysto is short for cystoscopic exam. eGFR is the estimated glomerular filtration rate. ESRD stands for end-stage renal disease. ESWL is extracorporeal shockwave lithotripsy. HCO3 is bicarbonate, an electrolyte that's conserved by the kidney. HD stands for hemodialysis. IC is interstitial cystitis, which is a chronic inflammation of the bladder wall. IVP is intravenous pyelogram. K plus stands for potassium, which is an important electrolyte. KUB is kidney, ureter, and bladder. Na plus is the chemical abbreviation for sodium, another electrolyte. PD stands for peritoneal dialysis. pH is the potential of hydrogen. This is the degree of acidity or alkalinity. PKD is phenylketonuria. SPGR stands for specific gravity. A UA is a urinalysis. A UTI is a urinary tract infection. And the VCUG, remember that's the voiding cystourethrogram. Okay, so what does the abbreviation RP, which one is it associated with? Is it fluid, when fluid is injected into the peritoneal cavity and then drained out? Is it when contrast is injected into the urinary bladder and ureters and x-rays are taken of the urinary tract? Is it when nitrogenous wastes are removed from the patient's blood? Or is it an electrolyte as secreted by renal tubules? Let's see. Correct answer is B. That's the abbreviation for retrograde pyelogram, RP. Okay, so let's look at the combining forms now. Albumino, which means albumin or protein. Angi or angio is a blood vessel. Azot or azoto is urea or nitrogen. This is review now from the last lesson as well, right? Bacterio, chelio or chelicio, cysto, dipso, glomerulo, glycoso, hydro. Isk or isco means the back or to hold back. Cal is the K, stands for potassium. Keto, ketano. Litho, meato. Natro, necro. Nephro, nocto, oligo. Pio, piello, reno, trigano, and uro. And ureter, urethro, urino, and vesico. Here's our suffixes. Ectasis is stretching and dilation. Ectomy, removal or excision. Emia is a blood condition. Esis is just a condition. Gram, remember that means a record. Or lithiasis is a condition of stones. Lithotomy is the incision for removal of a stone. Lysis means to break down. Megaly is enlargement. Oli is little or small. Osis is a condition. Pathy is a disease. Plasty is surgical repair. Poietin is a substance that's formed. Ptosis is a droop or sag. Rhea means flow or discharge. Sclerosis is hardening. Stomy means to create a new opening. Don't confuse that with tomy, which is the process of cutting. Trypsy is to crush, and urea is meaning urination. Some prefixes are a or an, which means without or not. Anti is again or against. Dia means complete. Dis means bad or painful. En means within. Peri is surrounding. Poly means many of them or lots of them. Retro is behind or in back. And the combining form dipso means what? What do we remember? We just looked at that one, right? Stone, scanty, thirst, or water. So the answer should be C, right? Thirsty. Pretty sure we just looked at that one. Yep. Okay, and which combining form means pus? It's pio, right? And the combining form isk or isco means scanty, to hold back, night, or trigon. And it's B, to hold back or in the back. Okay, great. So that's the end of lesson 7.2. Okay, welcome students. This is lesson 8.1. So we're going to cover the terms of sexual reproduction. This is the union of the nuclei of an ovum and a sperm cell. And those are each called gametes. Each gamete contains half the number of chromosomes of a normal body cell. So half from the sperm and half from the ovum. Gametes are produced in the gonads. The female gonads are the ovaries, and the male gonads are the testes. So, how does fertilization occur? An ovum leaves the ovaries and then travels through the fallopian tube, and fertilization takes place if sperm cells are present and unite with the ovum. The fertilized egg then implants and then divides to form a ball of cells called a zygote, which later turns into an embryo and then a fetus. So the organs of the female reproductive system from the lateral view are the ovaries, fallopian tubes, uterus, cul-de-sac, vagina, Bartholin glands, clitoris, perineum. Okay, so that was all kind of in order from top to bottom. Looking at a lateral view. Okay, who remembers when the fertilized egg implants and then divides to form a ball of cells? What is that called? That is the zygote, right? D. So we're going to continue with the anterior view. We're going to look at the ovary, utero-ovarian ligament, ovarian follicles, ovum, the corpus luteum, and the fallopian tube. So this is our anterior view. The fundus, the corpus, the uterus, endometrium, myometrium, uterine serosa, cervix, vagina, uterine artery and vein, broad ligament, utero-ovarian ligament, the ovary, corpus luteum inside the ovary, as well as ovarian follicles, and then an ovum making its way out of the ovary. There's fimbriae on the edge of the fallopian tube. All right, we'll look at the anatomical structures of the breast in a sagittal view. There will be glandular tissue, fatty tissue, ducts, and sinuses. Also lymph nodes up here, the pectoralis major and pectoralis minor muscles underneath the breast, glandular tissue attached to ducts, attached to sinuses, all surrounded by fatty tissue, and then the ribs are back here underneath the pectoral muscles. Menstruation. So during the menstrual cycle, on days 1 through 5, the blood cells, endometrial cells, and glandular secretions are being discharged from the body. During day 6 through 12, estrogen aids the repair of the endometrium, and the ovum grows in the follicle. Around day 13 or 14, the egg leaves the ovary and passes through the fallopian tube. And then day 15 to 28, the corpus luteum secretes progesterone and the uterus lining builds up again. Now, if fertilization occurs, then pregnancy concurs, and this process will halt. But if there's no fertilization, then it begins again after the uterine lining has built up to go back to day 1, where they begin to discharge from the body. So here we have the days down here, back to starting at day 1 and then back to day 1. You can see what's happening in the uterus here with the uterine lining. It gets emptied, and then as it repairs, it builds up and then breaks down again. It's peaking at ovulation and then troughing during menstruation. And then in the ovary, you can see that you have low estrogen progesterone here during menstruation, and then it peaks at ovulation. And the ovarian follicle with the ovum is maturing, and then the ovum releases, and the corpus luteum secretes the estrogen and progesterone, at peak at ovulation time, and if no fertilization, there's low levels of estrogen and progesterone again. So, as I said, if fertilization occurs, the egg implants in the uterine endometrium. The placenta forms and attaches to the uterine wall. Amnion holds the fetus in an amniotic cavity. Nutrients, oxygen, and wastes exchange between the fetus and the mother. The placenta produces human chorionic gonadotropin, commonly referred to as HCG. So here you see the egg or the ovum being released from the ovary down, making its way through the fallopian tube. Fertilization occurs here, and then when it gets down to the uterus, it implants into the endometrium. That is known as implantation. And here's an image depicting the placenta, which is attached here, you can see, to the uterus wall with internal blood vessels, the umbilical cord connecting it to the fetus. There's umbilical arteries and a vein. This is the chorion, the edge of the sac, and then the amniotic cavity and the amnion. Who remembers what the corpus luteum secretes monthly to build up the lining of the uterus? Anybody remember? So that is the progesterone. C. Progesterone builds up the lining of the uterus. And what does the placenta secrete during pregnancy? That is HCG, the human chorionic gonadotropin. Answer is B. So during pregnancy, progesterone maintains placenta development. The uterus expands as the fetus grows, and then the normal delivery fetal position is referred to as cephalic presentation, which just means that it's the head first, head of the fetus. There are 3 phases of labor. First one is dilation and thinning of the cervix. 2 is the birth of the infant, and then 3 is the subsequent delivery of the placenta, also known as the afterbirth. So here's an image depicting the cephalic presentation of the infant, coming out here head first, and then afterwards delivery of the placenta. It detaches from the uterus wall. The amnion is still in there, and sometimes the umbilical cord is cut. Sometimes people now leave it on for a much longer period of time. Hormonal interactions. So the pituitary secretes follicle-stimulating hormone, FSH, and luteinizing hormone, LH. The pituitary stops producing those hormones during pregnancy and then when oral contraceptives are being taken. So that suppresses the production of FSH and LH because they are no longer needed. Menopause is the gradual ending of the menstrual cycle. It normally begins between ages 45 and 55. It's characteristic with falling estrogen levels. And there is an option for estrogen replacement therapy, or also it's referred to as hormone replacement therapy, HRT, but there's definitely risks to these therapies, so careful consideration should definitely be required. Okay, so our terms. Adnexae uteri, that is the fallopian tubes, ovaries, and supporting ligaments. Amnion is the innermost membranous sac surrounding the developing fetus. Areola is the dark pigmented area surrounding the breast nipple. Bartholin glands are small mucus-secreting exocrine glands at the vaginal orifice. These are named after Caspar Bartholin, who was a Danish anatomist who described them back in 1637. The cervix, which is the lower portion of the uterus that kind of looks like a neck. Chorion is the outermost layer of the two membranes surrounding the embryo. Clitoris is sensitive erectile tissue that's anterior to the opening of the female urethra. Coitus is sexual intercourse, also known as copulation. Corpus luteum is the empty ovarian follicle that secretes progesterone after the release of the egg cell. And this actually means yellow body. Corpus is body, right? Luteum is yellow. Cul-de-sac is the region in the lower abdomen midway between the rectum and the uterus. Embryo is the stage in prenatal development from 2 to 8 weeks. The endometrium is the inner mucous membrane lining of the uterus. Estrogen. This is the hormone produced by the ovaries that promotes female secondary sex characteristics. Fallopian tube, one of a pair, so there's 2 fallopian tubes. These are ducts through which the ovum travels to the uterus. The oviduct is the other name for it, and this is named after Gabriello Falloppia, an Italian anatomist. Fertilization is the joining or union of the sperm cell and the ovum from which the embryo develops. Fetus. This is the stage in prenatal development from 8 to 39 or 40 weeks. Fimbriae, which is the plural. The singular would be fimbria. These are the finger or fringe-like projections at the end of the fallopian tubes. Follicle-stimulating hormone. This is secreted by the pituitary gland to stimulate maturation of the ovum, FSH. Gamete, that's either a male or female sexual reproductive cell. So for men, that would be the sperm, and women, it's the ovum. Genitalia, that is the reproductive organs, also called genitals. Gestation is the period that occurs from fertilization of the ovum to the birth of the infant. Gonad is the reproductive organ that produces sex cells and hormones. For men, it's the testes, and women, it's the ovary. Gynecology is the study of female reproductive organs, including the breasts. Human chorionic gonadotropin, HCG, that is the hormone produced by the placenta to sustain pregnancy by stimulating ovaries to produce estrogen and progesterone. The hymen is a thin mucous membrane that partially or completely covers the opening to the vagina. Labia are the lips of the vagina. Lactiferous ducts are tubes that carry milk within the breast. Luteinizing hormone, LH, is secreted by the pituitary gland to promote ovulation. Mammary papilla is the nipple of the breast. Menarche is the beginning of the first menstrual period, which is the ability to reproduce. Menopause is the gradual ending of menstruation. Menstruation is the monthly shedding of the uterine lining. The myometrium is the muscle layer of the uterus. Remember, myo means muscle. Neonatology is the branch of medicine that studies the disorders and care of the newborn. Newborns are also referred to as neonate. Obstetrics is the branch of medicine concerned with pregnancy and childbirth. Orifice is an opening. Ovarian follicle is the developing sac that includes each ovum within the ovary. The ovary is one of a pair. There's 2 ovaries. They're female organs on each side of the pelvis. They're almond-shaped, and they produce egg cells and hormones. Ovulation is the release of the ovum from the ovary. And the ovum is a mature egg cell, which is the female gamete. Ovum is singular and plural is ova, more than one egg cell. Parturition is the act of giving birth. This is often abbreviated as para. Perineum is the area between the anus and the vagina in females. Pituitary gland, this is the endocrine gland at the base of the brain. It produces hormones that stimulate ovaries, and there's also lots of other hormones that it produces as well that regulates other organs. Placenta is the vascular organ attached to the uterine wall during pregnancy. It allows the exchange of oxygen, nutrients, and fetal waste products between the mother and the fetus. Pregnancy is the condition of having a developing embryo and fetus in the female uterus. It says for about 40 weeks, but of course we know that not all pregnancies last 40 weeks. That is the average gestation period. Progesterone, this is the hormone produced by corpus luteum in the ovary and placenta of pregnant women. Puberty is the point in life cycle at which sex characteristics appear and gametes are beginning to be produced. The perimetrium is the outermost layer surrounding the uterus, also referred to as the uterine serosa. The uterus is the hollow, pear-shaped, muscular female organ in which the embryo and fetus develop and from which menstruation occurs. Vagina is a muscular, mucosa-lined canal extending from the uterus to the exterior of the body. Vulva is the external female genitalia. This includes the labia, hymen, clitoris, and vaginal orifice, so it's all of those wrapped up together. Zygote is the stage in prenatal development from fertilization and implantation to 2 weeks. So that's a pretty short time period. So it's only a zygote for the first 2 weeks. Okay. Which term refers to the inner mucous membrane lining of the uterus? Do you remember that one? Oops. Let's go back. It should be the endometrium. A. Okay, here's our combining forms, suffixes, and prefixes. Amni or amnio for amnion, Bartholino, cervico, chorio, coriano, colpo, coldo, episio, galacto, gyneco, hystero, lacto, mammo, masto, meno, metro, myo, myomo, natty, obstetro, or uo, ufero, ovo, ovo, ovario, ovulo, perineo, foro, salpingo, utero, vagino, vulvo. The suffixes are archi, Cyasis, gravida, paris, rhea, salpinx, tosia, virgin, dis, oh here we're in our prefixes again, dis, endo, in, intra, multi, nulli, pre, primi, retro. Okay, which term means the removal of the breast? So, mammoplasty. That mammo is breast, right? Plasty is surgical repair. So that's not it. Mastitis. Okay, we know itis means inflammation, so that's not it. Hysterectomy. So ectomy sounds right for removal, right? But hystero is for the uterus. So mastectomy would be masto or masti for a breast and ectomy for removal. So the correct answer is B. And that's the end of lesson 8.1. Okay, students, this is a really quick one. Lesson 8.2. We're just looking at the pathology of the female reproductive system. So for the uterus, it's cervical cancer. Those are malignant cells within the cervix. Cervicitis, which is inflammation of the cervix. Endometrial cancer, where there's a malignant tumor of the uterine lining. Endometriosis, when endometrial tissue located outside the uterus. Fibroids, which are benign tumors of the uterus. So here's some illustrations of some pedunculated fibroids, submucosal, subserosal, intramural, and pedunculated vaginal fibroids. For the ovaries, there's ovarian cancer, malignant tumor of the ovary, ovarian cysts. These are collections of fluid within a sac in the ovary. In the fallopian tubes, there's PID, which is pelvic inflammatory disease. Examples of that are salpingitis, oophouritis, endometritis. The leading cause of PID is STDs, or sexually transmitted diseases. For the breast, there's breast cancer and then fibrocystic disease. There's some arrows in this imaging that are pointing to an invasive carcinoma of the breast. And here's a cut section of the invasive ductal carcinoma of the breast, right here. So that's the end of lesson 8.2. It's quick. All right, this is lesson 8.3. Pathology of pregnancy. Abruptio placentae. That is the premature separation of the placenta, which should normally be implanted. Choriocarcinoma. That's malignant tumor of the placenta. Ectopic pregnancy. This is when the egg implants in a knot in the uterus, so it's misplaced. Placenta previa and preeclampsia. Pathology of the neonate. There's Down syndrome, hemolytic disease of the newborn, hyaline membrane disease, hydrocephalus, meconium aspiration syndrome, and pyloric stenosis. Newborns are scored using the APGAR chart. This is an assessment of the newborn that is usually done between 1 to 5 minutes after they are born. So the sign that is looked at is the heart rate. If it's absent, they get a 0. Below 100, they get a 1. Over 100, they get a 2. Respiratory effort, absent is 0. 1 is slow and irregular. 2 is good, means they're usually crying. Muscle tone, if it's limp, it's 0. There's some flexion, it's 1. And if there's active motion, it's 2. And then they test the nostril after the oropharynx is clear completely of amniotic fluid. So the response to the catheter in the nostril, if there's no response, the score is 0. If they grimace, the score is 1. And if they cough or sneeze, the score is 2. That's normal. Color, if they're blue and pale, it's a 0. If the body is pink but the extremities are blue, there's a 1. And if they're completely pink, then it's a 2. So obviously you want your infant to have all 2s on the APGAR scoring chart. Clinical tests and procedures during the pregnancy would be a pregnancy test and then a pap test or pap smear. Procedures are a hysterosalpingography, mammography, breast ultrasound or breast MRI, pelvic ultrasonography. Conization is a gynecological procedure, which is a removal of a cone-shaped section of the cervix. This figure shows a leap for a cone biopsy. There's also a laparoscopic oophorectomy. This is when the ovary is placed in a plastic bag and then extracted through the laparoscope. Procedures during pregnancy. An amniocentesis is when there's a needle placement guided by ultrasound images into the amniotic fluid. Okay, so let's make sure we know our abbreviations. AB is abortion, AFP is the alpha fetoprotein high levels. BRCA1, BRCA2, these are the breast cancer 1 and 2 genetic mutations that are associated with an increased risk for breast cancer. BSE is the breast self-examination. CA125 is a protein marker that's elevated in ovarian cancer. C-section or CS is cesarean section. CIN, cervical intraepithelial neoplasia. CIS, carcinoma in situ. Chorionic villus sampling, that's CVS. CX stands for cervix. Make sure it's a capital C and a lowercase x. D and C is dilation and curettage. DCIS, ductal carcinoma in situ. DUB, dysfunctional uterine bleeding. FHR, the fetal heart rate. FSH, follicle stimulating hormone. G stands for gravida, which means pregnant. GnRH is gonadotropin releasing hormone. GYN stands for gynecology. HCG is the human chorionic gonadotropin. HDN, hemolytic disease of the newborn. HPV, human papillomavirus. HRT is the hormone replacement therapy. HSZ, hysterosalpingography. IUD is an intrauterine device, which is a contraceptive. IVF is in vitro fertilization. LEEP is the loop electrocautery excision procedure. LH, luteinizing hormone. LMP is the last menstrual period. Multi-P is multipara or multiparous, which means more than one pregnancy. OB stands for obstetrics. Para 2-0-1-2, this would be a particular woman's reproductive history. All right, so 2 means 2 full term, 0 preterm, 1 abortion, and 2 living. Papa Nicolau smear test, that's the pap test or pap smear. PID, pelvic inflammatory disease. PMS, premenstrual syndrome. PRIMIP stands for primipara or primiparous. SLN biopsy, or an SNB, is the sentinel lymph node biopsy. TAH-BSO is the total abdominal hysterectomy with bilateral salpingo-oophorectomy. So that's pretty much taken everything out. UAE is the uterine artery embolization. VH is a vaginal hysterectomy. Okay, let's look at our combining forms. A lot of these are repeats from our last lecture as well. Amnio, Bartholino, cephalo, cervico, chorio, choriano, colpo, coldo, apesio, galacto, gyneco, hystero, lacto, mammo, masto, meno, metro, myo, myomo, natty, obstetro, oligo, oo, Ufero, ovo, ovario, ovulo, perino, foro, paio, salpingo, utero, vagino, volvo. Our suffixes are archi, cili, sciasis, ectasis, ectomy, flexion, genesis, gravida, itis, perunia, paris, plasia, plasty, ptosis, ragia, raphy, rhea, salpinx, scopy, stenosis, stomy, tosia, tomy, tresia, version. Prefixes: bi, dis, endo, in, intra, multi, nulli, oxy, peri, pre, primi, pseudo, retro, uni. And that's it. That's the end of lesson 8.3. Okay, this is lesson 9.1. Introduction. The male sex cell is called a spermatozoon, or sperm cell. The sperm cell carries its nuclear hereditary material, also known as chromosomes, in the head region, and it has a tail that is a flagellum, which makes the sperm cell mobile. So it flagellates back and forth to move the cell. Only one spermatozoon out of 300 million sperm cells is released. Out of the 300 million that are released during ejaculation can actually fertilize a single female ovum. So that's actually not very good odds, right? Only 1 out of 300 million. If more than one egg is present in the fallopian tubes during ejaculation, then multiple fertilizations are possible, right? That's how we end up with multiple fetuses. So twins resulting from the fertilization of 2 separate eggs by separate sperm cells are called fraternal twins. And then twins that result from the fertilization of 1 single egg by a single sperm are called identical twins. The organs of the male reproductive system are designed to produce and release billions of sperm cells throughout the man's life. The hormone called testosterone is responsible for the bodily characteristics of the male, such as a beard, pubic hair, and a deeper voice. The anatomy of the male reproductive system we will look at is the testes, scrotum, perineum, seminiferous tubules, epididymis, vas deferens, seminal vesicles, ejaculatory duct, and urethra. Okay, so ureter, urinary bladder, pubic bone, prostate gland, down here to the urethra. Oh, sorry, the Cowper glands are down there as well. Whoop. Okay, then we have the vas deferens right here, which connect the, these are the testes with the seminiferous tubules inside, the epididymis on the outside, and then the vas deferens connects those to the ejaculatory duct, which then connects down to the urethra. Yep, seminal vesicles there as well. Internal structure of the testes and the epididymis. The testes contain seminiferous tubules out to the epididymis through the vas deferens. There's also testicular veins and a testicular artery there, and then they all get wrapped up nice and neat inside the spermatic cord. Now, when vasectomies are performed, this is what is severed, the vas deferens right here. So then the sperm is no longer able to leave the epididymis. So the route or passage of sperm from the seminiferous tubules to the outside of the body. They're formed inside the tubules, which are inside the testes. They go out to the epididymis, in through the vas deferens, which is the seminal vesicles, to the ejaculatory duct, then meeting there in the urethra, near the prostate gland and the Cowper glands, and then that passes through the penis where they leave the body. Okay, so our vocabulary terms are the bulbal urethral glands. This is the pair of exocrine glands near the male urethra, also known as Cowper glands. Ejaculation is the ejection of sperm and the additional fluid from the male urethra. The ejaculatory duct is the tube through which the semen enters the male urethra. Epididymis, or plural is epididymides. The singular epididymis is one of a pair of long, tightly coiled tubules above each testes that stores and carries sperm to the vas deferens. Erectile dysfunction is the inability of an adult male to achieve an erection. It's also called impotence. Flagellum is the single hair-like projection on a sperm cell that makes it motile or makes it move. Fraternal twins are two infants resulting from fertilization of two separate ova by two separate sperm cells. The glans penis is the sensitive tip, comparable to the clitoris in the female. Identical twins are two infants resulting from the division of one fertilized egg into two distinct embryos. Sometimes there are conjoined twins, also known as Siamese, that are not completely separated, identical twins. Interstitial cells of the testes, these are the specialized cells adjacent to the seminiferous tubules in the testes. They produce testosterone. They're also called the Leydig cells. Parenchymal tissue is the essential distinctive cells of an organ. The penis is the male external organ of reproduction. Perineum is the external region between the anus and the scrotum in the male. Remember, females also have a perineum in between the vaginal opening and the anus. The prepuce is the foreskin or the fold of skin that covers the tip of the penis. Prostate gland, that's the exocrine gland at the base of the bladder in males. It secretes fluid that's part of semen into the urethra during ejaculation. Scrotum is the external sac that contains the testes. Semen contains spermatozoa and seminal fluid that's discharged from the urethra during ejaculation. The seminal vesicles are some exocrine glands. There's a pair, they're sac-like. They secrete fluid into the vas deferens. The seminiferous tubules are narrow coiled tubules that produce sperm in the testes. Spermatozoon, which is a single sperm cell, and then plural would be spermatozoa. Sterilization is the procedure that removes a person's ability to either produce or release reproductive cells through either the removal of testicles, a vasectomy, or for women it would be an oophorectomy. Stromal tissue, this is the supportive connective tissue or an organ, also known as the stroma. Testis is the singular, plural is testes. Those are the male gonads, which are testicles that produce spermatozoa and testosterone. Testosterone is the hormone secreted by interstitial tissue of the testes. It's responsible for the male sex characteristics. Vas deferens are the narrow tube carrying sperm from the epididymis toward the urethra. It's also called the ductus deferens. Okay, so which term refers to the skin covering the tip of the penis? Who remembers that one? It is C, the prepuce. Okay, so here's our combining forms. Andro, balano, cryo, crypto, epididymo, gono, hydro, orco, orchio, or orchido. Pino, prostato, semini, spermo, terato, testo, varici or verso, vaso or vaso, zoo, Suffixes are genesis, 1, pexi, stomy. Oh, and that's it. That's the end of 9.1. Okay, this is lesson 9.2, which is pathology of the male reproductive system. So pathologic conditions are the hydrocele, which is a sac of fluid in the scrotum. Testicular torsion is when the spermatic cord gets twisted, right there. And then variocele is when the spermatic veins are dilated abnormally. Here is the prostate gland with carcinoma and BPH. So right here, the prostate gland 1 and 2. Here's a prostatic carcinoma, and then a benign prostatic hyperplasia on this one. That's also known as BPH. Hypospadias is the surgical repair that involves exciting a portion of the prepuce, wrapping it around a catheter, suturing it to the distal part of the urethra, and then bringing it to the end of the penis. Hypospadias. Urethral opening is now on the underside of the penis. Sexually transmitted infections, or STIs, include chlamydial infection, gonorrhea, herpes genitalis, HPV, or the human papillomavirus, and syphilis. There's some lovely pictures in your textbook illustrating the dangers of those infections. Lab tests, there's the PSA and semen analysis. So what does the PSA stand for, or what does it test for? Sorry. Levels of infection, sperm mobility, sperm motility, or levels of an antigen. So the correct answer is D, levels of an antigen. So the PSA is the prostate-specific antigen. That's what PSA stands for. So high levels of this antigen indicate that the prostate gland is enlarged, which can often be a sign of cancer. Clinical procedures include the transurethral resection of the prostate, which is often referred to as the TURP. This is where they insert a resectoscope in the urethra, down into the prostate gland, and then resection that. Clinical procedures are the vasectomy. So that is when the physician makes an incision right here, just goes in, cuts, and then blocks off both ends of the cut vas deferens, and then removes the excised segment and sutures it back up. So that is a form of sterilization. So which term means removal of the prostate? Orchiectomy, prostatectomy, vasectomy, or prostatitis? This one's pretty easy, right? We know ectomy means removal. Vasectomy is the removal of the vas deferens. Orchiectomy would be removal of a testes, so prostatectomy is pretty obvious. That's going to be the removal of the prostate. Okay, our abbreviations are BPH, benign prostatic hyperplasia, DRE, digital rectal examination, ED, erectile dysfunction, GU, which is genitourinary, HPV, human papillomavirus, HSV, or herpes simplex virus, PID, pelvic inflammatory disease, PIN, prostatic intraepithelial neoplasia, PSA, that's the prostate-specific antigen, RPR, rapid plasma reagent, STI, sexually transmitted infections, or you could refer to it as STD, sexually transmitted disease, a TRUS or TRUS, that's the transrectal ultrasound, a TUIP, transurethral incision of the prostate, TUMT, transurethral microwave thermotherapy, a TUNA, the transurethral needle ablation, And the TURP is the transurethral resection of the prostate. Okay, so our combining forms are andro, balano, cryo, crypto, epididimo, gono, hydro, orco or orchio, pino, prostato, semino or semini, spermo, terrato, testo, varicio, vaso, zuo. Suffixes are genesis, one, pexi, stomi. And to wrap it up, which term means no sperm or semen are produced? Spermolytic, anorchism, oligospermia, or aspermia. Well, remember that A, the prefix A means without. So anorchism would be without testes. Aspermia is without sperm. So A is the correct answer. And that wraps up lesson 9.2, counterparts. So we are used to measuring things in inches or feet as far as size and length. And the metric equivalent would be meters and centimeters. We're used to weighing things, solid objects in ounces and pounds. And in the metric system, we weigh in grams and kilograms. And then in liquids that we measure out in cups, quarts, gallons. But in the metric system, we use liters and milliliters. And then we measure distance in miles, is what we're used to. On our car, we have our miles per hour to calculate our speed. And then in the metric system, we use kilometers. Okay. So the metric system is based on the decimal system, in which everything is divided and multiplied by tens. So it's actually pretty simple once you kind of understand that. So the three basic units of measurement are: for solids, we weigh in grams. For liquid, volume is measured in liters. And then the basic unit for length is a meter. And drug dosages are calculated by using the metric measurements that relate to weight and volume. So the gram is abbreviated as a little g. The microgram is mcg. The milligram is mg. That's one we use all the time, right? Kilogram is kg. Liter is a capital L, a big L. And then milliliter is a small m, and then that capital L for liter. Okay, there's some basic prefixes that we can understand and add on to any of these basic units right here. Okay, so kilo means that you're going to multiply it by 1,000 times. Milli means that you're going to divide it by 1,000, right? So it's a fraction, 1,000th, so it's pretty small. And then micro is really, really, really small. You're dividing it by 1 million, so it's 1/1,000,000th of a part. Right here, that's a very small number. Okay, so for volume conversions, 1 liter is 1,000 milliliters, because remember, milli means to divide by 1,000. 1 gram is equal to 1,000 milligrams, because remember, milli is divided by 1,000. And then 1 milligram is equal to 1,000 micrograms, because remember, micro means to divide by 1 million. And 1 kilogram equals 2.2 pounds. So if we need to convert from kilograms to pounds, or usually we're converting from pounds to kilograms, say your patient weighs 150 pounds. So how many kilograms is that? Well, we're going to take 150 and we're going to divide it by 2.2. Okay, and that is 68.18 and then 18182. So we're going to round that up, right, to 68.2 kilograms is how much our patient weighs in kilograms. And then if we want to convert from kilograms to pounds, so say our patient weighs 200, no, that would be a lot, sorry. Say our patient weighs 90 kilograms. We're going to take 90 and multiply it by 2.2. Okay, and that's 198 pounds. So that's pretty easy. If you can just remember 2.2 is the conversion. All right, so our basic formula for calculating drug dosages. This is one that you're going to want to memorize. Okay, so it's dose over on hand times the quantity. Okay, so I usually set it up like this. D over H times Q. And then we'll have our answer. Okay, so D is whatever the provider ordered. So that's what you want. And then H is whatever you actually have on hand. So what's available to you. And then the volume that measurement is mixed into. Okay, so we'll practice this. So first of all, we need to be able to read the medication labels. Super, super important. So when we're looking at it, we need to find the quantity, the dosage that's measured out on the label, right? So that's right here. So in this bottle, this vial, that is 5 milliliters total, there's 20 milligrams of this medication, irinotecan hydrochloride, right? That's the medication name right here. So there's 20 milligrams of that in each milliliter per 1 ml, right? So we can think of this as 20 milligrams in 1 milliliter. Okay, and this vial has 5 milliliters in it total. So how many milligrams is in this whole vial? I usually like to figure this out, right? So how can we know that? Well, if there's 20 in 1, if we take this number and multiply it times 5, right, then we'll have 100 milligrams. So that's how many milligrams is in this whole vial, which is good to know, right? Okay, so this one right here, methylprednisolone, right? That's the name of the drug, injectable. It has 40 milligrams for each milliliter. And this vial is a multi-dose vial with 5 milliliters in it. So 5 times 40, right? That's how many milligrams are in the whole vial. So it's always good to know, right? 5 times 40, there's 200 milligrams in the entire vial. Okay, this one for Ativan or lorazepam, there's 2 milligrams for each milliliter. And this must be a large box, right, that has 1 milliliter vials, but 25 of them total. Okay, so each milliliter contains 2 milligrams of lorazepam. So So this is a single dose, probably a single dose vial with 1 ml in it, each one. All right, buprenorphine hydrochloride, 0.3 milligrams per 1 ml. Okay, and there's 1 ml in the vial. So hopefully this is the amount that your provider's going to order, but you never know. But if they don't, we'll know how to convert it. Okay, digoxin, there's 500 micrograms per 2 mLs. And this is nice because they actually converted it to milligrams for you already, right? But the way we would do that is just divide by 1,000, right? But it's 0.5 milligrams in 2 milliliters. And this is a single ampule with 2 milliliters in it. Okay. So if we don't need to make any metric conversions, this is how we're going to do our dosage calculations. So the physician has ordered 10 milligrams of a medication to be given subcutaneously. And the medication comes in a multi-use vial. Okay, so this is important to note. It's 5 mLs total. And the label reads 15 milligrams per milliliter. Okay, so that's a different amount than what was ordered. So we're going to need to make a calculation to know how much of this to inject subcutaneously into the patient, right? So if we set it up with our dose, okay, with our conversion formula here, the dose ordered is 10 milligrams, okay? Now we're going to put that over what we have on hand, and that is 15 milligrams. That's what we actually have in our hand, okay? Now we're going to multiply that by the quantity that we have. So for each 15 milligrams, it's 1 milliliter. All right, so we're going to multiply that times 1 milliliter to get our amount. Now, these cancel each other out, right? Milligram and milligram cancels out. And so we just have to do 10 divided by 15. Which is 0.666666667, right? That's a lot. Milliliters. Well, there's no way we can measure out that. So we're going to round it up. Usually the nearest tenth is sufficient. Okay? So that's going to round up to 0.7 milliliters. That's how much of this medication we're going to draw up out of the multi-use vial and administer into the patient in order to give them 10 milligrams of the medication. Okay, let's try another one. So the physician orders 60 milligrams of Solumedrol. What you have on hand is a 10 milliliter multi-use vial, and the label says that there's 125 milligrams per 2 mLs. Okay, so how do we know how to give 60 milligrams? Okay, so our dose ordered, right, is 60 milligrams. We're going to put that over what we have on hand, which is 125 milligrams. And we're going to multiply that by the quantity, which is 2 milliliters. Okay. And again, these cancel each other, and we do your work left to right, right? So 60 divided by 125 is 0.48, and now we're going to multiply that by 2 milliliters. Okay, and so we have 0.96 milliliters. All right, so it would be pretty hard to measure that out unless we had a tuberculin syringe, right? Something really small. So we'll round it up to 1 milliliter. That's how much we're going to draw out of this 10 milliliter multi-use vial so that we can administer 60 milligrams of Solu-Medrol. Okay, so sometimes we need to convert from one unit of measurement to another, and that's known as a conversion when we change that. We often have to do that in order to prepare the correct dosage. Okay, so these examples we didn't have to convert at all, so they were super easy, right? But we have to do it when what was ordered is 1 unit of the medication, but the label has a different unit of measurement. So for example, the physician orders 400 micrograms of a medication, but the label gives us the strength in milligrams, right? So we need to convert from micrograms to milligrams so that we know how much to administer. And we use our conversion factors here, right? So we know that this equals this. So we can use these in our equations to convert. Okay, so for example, the physician orders 0.5 grams of a medication to be given IM, and the label on the medication says that it's measured in milligrams, right? So we need to convert milligrams to grams. And we can do that because 1 gram equals 1,000 milligrams. Okay, so we're going to set it up like this. We want to go from 0.5 grams, and we have 250 milligrams, right? So we're going to stick in that conversion factor there before we take care of the amount, the quantity. So this is still dose over what we have on hand times the quantity, but we're just adding in that conversion factor in between. Okay, so we're going to set them up, always set them up opposite from each other. That's how you can get them to cancel out, right? So this gram cancels out this gram, and this milligram cancels out this milligram. So we know that 1,000 milligrams is the same as 1 gram. So now we can do our math, start from left to right. Okay, and so we go, say, 0.5 divided by 250, okay, which is 0.002, and then we're going to multiply that times 1,000, okay, and these have canceled out. Milligram, milligram cancels, gram and gram cancels, so we can forget all of those. Okay, and that gives us 2. Okay, now we need to remember to multiply that times the 2 milliliters that comes in right here. So 2 times 2 is 4, right? Oops. 2 times 2 equals 4. So we're going to draw up 4 milliliters of this medication here in order to give 0.5 grams of the medication. So it's just an extra step in there, right? And here's another way of thinking of it. 0.5. You can put them all together into 1 when you cancel these out. Milligrams, milligrams, grams, grams, and then you can put them all here together. 0.5 times 1,000. See, I did that step first, right? And then times 2 milliliters, and then divided by 250, right? And we end up with 4 mLs. Okay, I'm going to pause this video to give you a little break, and then we'll try some more problems together.